My name is Palesa Ramohlouoane. I'm a mental health counselor licensed in the state of New York. I am a part of church leadership. I am also a wife and a mother. I am also proudly South African from Johannesburg. The question of history and the trauma that South Africa has been throughout the decades. I'm not a historian, but speaking as a clinician, yes, our history and historical events, especially involving trauma, tend to, travel with us. They become a part of us. These sufferings get passed on from generations to generations. If you look at behavioral patterns, you will notice similarities between, for example, a father and a son. So it is not something we can deny that our traumas still have impact on us today, especially South Africa. One of the ways to really impact that is to, have interventions that are intentionally aiming to redirect and form something more meaningful through what we've been through. South Africa's context and circumstances now put leaders directly in a good position to really analyze and to work together to address some of the core yearnings that people are crying out for. That we see that through the behavioral interventions. South Africa and interventions. Now, that question is really a broad one. Yes, we do need African interventions. It's very important. Our circumstances and contexts are very different. We have different cultures, we have different traditions, we have a unique wisdom that we need to put down as a part of what we would formulate as strategies for healing. Now, when we talk about whether mental health is necessary, it almost sounds like it's a choice. People today are dealing with a lot. In fact, I want to say that not only that people are dealing with a lot today doesn't mean that people in the olden days did not deal with a lot. In fact, if you look at the Bible, you will find that the issues that we are dealing with today are very similar to what they dealt with back in the days. Issues around power, issues around leadership, major conflicts, major life conflicts that they deal with, family problems. In fact, some of them, are even more than what we see today. And really what is also sad is that people want to be happy all the time. Now, that is not how the brain actually functions. The brain, which is where we acquire our mental health from, needs, it operates differently. So now when we behave in ways that are against how our brain should function, what we end up with is, pathological issues that we see through disturbances in function, which one can interpret as, behavioral issues that we see. and those can, you know, form a spectrum, you know, from you know, very, very you know, less severe issues to the most severe, where people are committing senseless crimes, you know, and using drugs. And really it is the problem of the entrapment of the suffering that is happening inside of a person. So yes, I think that we are in a great position to resolve this, or help ourselves, so to speak. So yes, you know, I think mental health services in our communities today really, really is much needed. As humans, we are actually one of the most, in fact, we are the most intelligent species. So we have the answer to all, or to stop some of the suffering, or at least to reduce it.